My name is Olivia and this is my fully insertion and removal video. Hi Miss Smith, my name is Olivia. I'm a WT nursing student. Can you verify your name and date of birth? Perfect. So I have a doctor's order to insert a Foley catheter. Do you have any reason that we wouldn't be able to do that? Okay, and do you have any allergies to shellfish, betadine, iodine, or latex? No? Okay, perfect. So the first thing I would do is provide peri-care with soap and water and a washcloth, non-sterile, and then now I would start my sterile procedure. So I'm going to take this and I'm going to place a towel beneath her. Perfect. So I will wash my hands and now we're starting our sterile procedure. So I would make sure to maintain a 1-inch border at all times. Okay, perfect. So now we're starting our gloving.
Oh, the removal of the wrapper. That I keep thinking I can't go outside. I'm trying to open it inside the box. Yeah, that's my part I need to watch. I just want to watch how she does it, because I'm struggling to get that wrapper off. That's the only thing.
I ripped my gloves. So, did they use my old ones?
To what?
Did they use my old ones? Because that kink in the tube.
I think I ripped my gloves too.
Okay, so I'm making sure to keep my hands in front of me at all times. So now we're gonna prep the kit. So I can open my swabs and I'm gonna get this. And for the sake of this video, we're using another lube, but I would use the sterile lube in here for the actual insertion. So, perfect. So I'm going to remove this. And I'm going to attach this. Perfect. And I'm going to lubricate my tip. Now this is not sterile, but I would make sure to use sterile lube for the actual procedure with a real patient. So now I can keep this all in front of me and move it over to the bed. Okay, Mrs. Smith, so I'm going to first clean her. As soon as I touch her with my left hand, it will no longer be sterile, but my right hand will be. So we're going to, this is still sterile. I did break sterile field there. And drop. I would make sure to not touch the patient with my sterile hand at all. And drop. Okay, Mrs. Smith. So on the count of 3, I'm gonna have you cough, okay? 1, 2, 3. Perfect. Perfect. Okay, so as soon as I see urine return, I'm gonna insert 1 more inch, and now I'm no longer having to maintain sterility, or however you say that. So next I'm going to insert saline into the balloon so that it inflates. Perfect. And I can remove that. And I'm going to make sure that I would attach this to the side of her leg and place this on the bed frame and lower than her bladder. So I'm no longer sterile. I would clean up my space. Mrs. Smith, every time you need to go to the bathroom, you need to call us so that we can help you, okay? Do you have any questions? Do you have any pain? No? Okay, perfect. So before I leave the room, I would perform hand hygiene, and bed is lowered, locked, the rails are lifted, her call light is in her hand, and I would ask her about pain, potty, possessions, and positioning. So now for documentation, I would do that today is February 13th. It is 1200. I inserted a 12 French Foley on one attempt. Patient experienced no pain. There was no urine output, but had there have been, I would have documented how much and like the characteristics of it. And then the patient was educated that they must call us if they need to go to the bathroom. I inserted 5 cc's of saline into the balloon. And then I would sign it and do my credentials at the end of it. So now for removal, this is not a sterile procedure, but for the sake of time, I'm going to keep these gloves on. I would wash my hands, put new gloves on, but first I'm going to come into the patient's room. Hi, Mrs. Smith. My name's Olivia. I'm a WT nursing student. We have an order to remove your catheter. Do you have any questions about that? No? Okay, great. Can you verify your name and date of birth? Perfect. So now I'd perform hand hygiene, put new gloves on, and I'm going to gather my supplies. So I'm going to place a towel beneath her, and I have the saline here. I would first empty any urine that was in the bag and document how much and the characteristics of it. Next, I'm going to remove the saline that was in the balloon. I would do this twice to make sure that there's nothing in there. Okay, Mrs. Smith, on the count of 3, we're going to remove this, okay? There should be no pain. 1, 2, 3. Perfect. Okay. So I would place this in a biohazard disposal bag or bin. Mrs. Smith, it is now, I would do perineal care also before, or like right after I removed it. So it is now 1300. You have to use the restroom within 8 hours, so that would be at 9 o'clock, so 2100. You must call us the first time you have to go so that we can document how much and the characteristics and everything like that. Are you experiencing any pain right now? No? Okay, great. So had she have not avoided in the next 8 hours, we would do a bladder scan and call the doctor and go from there. So before I leave the room, I would do the patient's bed is low, locked, call light is in hand, and the rails are lifted, and I would ask her about pain, potty, possessions, and positioning. I would do hand hygiene, and now we're going to document. So I removed it's February 13th. It is 1300. I removed a 12 French Foley from the patient. There was, we'll say 40 mLs of yellow cloudy urine in the bag that I removed beforehand. The patient was educated that in the next 8 hours she needs to use the restroom and she must let us know. So that would be at 2100 that I would document that's when she's due to void. Patient experienced no pain. Yeah, so I would sign my name and my credentials, and that's it.